listening to the Pharmacy Podcast Network.
Welcome to the PEERx to Peer Pharmacy Talk podcast, where we bring you the latest insights, expert discussions, and continuing education to enhance your pharmacy practice. I'm your host, Dixie Laycock, pharmacist. We invite pharmacy experts to discuss how ethics and pharmacy hot topics mesh. I am the president and CEO of Pharmacy Ethics Education and Resources, PEERx. At PEERx, our mission is straightforward, yet profoundly important: to educate healthcare professionals on ethics to improve patient safety. So whether you're a seasoned pharmacist looking to refresh your ethical knowledge or a new practitioner eager to build a solid ethical foundation, PEERx to Peer Pharmacy Talk is here for you. We will hear from the leaders in pharmacy, provide case studies, engage in thought-provoking discussions, and leave you with actionable solutions to elevate your professional practice. Together, let's make a positive impact on our profession and the patients we serve. All right. Hello, everyone. I'm Dixie Laycock, a pharmacist and entrepreneur. I also host a podcast series on the Pharmacy Podcast Network and Convey Med app called PEERx to Peer Pharmacy Talk. This podcast series is possible through a grant with WaypointRx and their amazing team. Please visit their website at waypointus.com for more information about their solutions for independent pharmacies, including their Prosper RX program. Today, I'm thrilled to have Dr. Tosin David with me. Tosin is a pharmacist for Clarent and hosts a continuing education podcast on the Convey Med app titled Preventing Adverse Drug Events Through a Culture of Well-Being. Tosin, welcome. It's fantastic to have you as a guest for PEERx to Peer Pharmacy Talk. How are you?
I'm doing great. Thank you so much, Dixie, for having me on your podcast. It's a true honor.
So excited. So let's start from the beginning. What inspired you to pursue a career in pharmacy?
Oh, wow. From the very beginning, I think it was truly a desire to interact with patients and be a part of the healthcare system. I think I always found that interesting. I had a father that was in the a healthcare professional as well. So I think just in some way, working with patients in pharmacy was a great avenue to do so.
Great. That's amazing. So you are a fairly new practitioner, and I happen to know you completed a community pharmacy residency in my hometown, like 5 minutes from where I grew up. So how did you get from Palm Beach Atlantic University, where you got your PharmD degree, to Fruitland, Maryland? I mean, we have a beach about 30 minutes away, but it isn't quite the same
Yeah.
as Palm Beach, Florida. So tell me about your journey, graduation, your residency, and then what got you to where you are now.
Sure. Yeah. So I was born and raised the beginning of my years in the District of Columbia, but most of my formative years were in Maryland and Prince George's County. And after I graduated high school, I kind of knew that I wanted to be in the health professions. And I also knew that I wanted a totally different environment. So I headed down south and I went to Palm Beach Atlantic, received my PharmD degree. But then after that, I did want to come back to Maryland. And that's where I found the community residency at Apple Discount Drugs. And just from a pharmacy's perspective, it was kind of interesting to see the practice of pharmacy in two different regions. And there really are so many differences between the two, and why really knowing your population and community is important. I mean, also besides the water is different, but the beach is the beach wherever you go.
True. Sand is sand, I guess.
Yeah.
So what made you decide to do a community residency versus another? Were you already interested in the community pharmacy space, or?
Yeah, I think the patient engagement and the workflow opportunities. I think really seeing that there was different care delivery modalities, and that's what really drew me to independent pharmacy. I really knew I wanted to do a residency with an independent pharmacy company. So that was kind of my focus of where are the different workflow engagements? How can we change care right with the population and the community that we're serving directly?
Great. Well, those of you who know me, independent community pharmacy is my, near and dear to my heart, having opened, had multiple locations for about 25 years, and we were able to keep our stores independent. I know the group, the family at Apple, they're kind of like my family too. So
Yeah.
I've known them for a long time. So now, I've had the privilege of knowing you also through our involvement with the Maryland Pharmacists Association. And I have to say, you jumped right in as soon as you got back to home, and you were recognized in 2023 with our Distinguished Young Pharmacist of the Year Award, which is graciously sponsored by Pharmacist Mutual Companies. I
Mhm.
happen to be privy to the reasons why you were selected for this award, since I serve on the past president's council that makes those selections. So you had served the association in so many different roles already, even though you've been here for less than 10 years. So tell me why you think it's important for new practitioners such as yourself to get involved in their state pharmacy associations, and a little bit about how you went your journey in MPHA as an example for others that they may follow.
Yeah, I think it really connects to my desire for the workflow and system changes, and they require advocacy. And there's no one that can advocate better for you than your state association. And that's something I picked up quickly, even when I was in another state. So I knew that that was something that I really wanted to do. And also, it provides networking opportunities. I was coming to a new state, new practice, and I have so many mentors, yourself included, Dixie, that really all came from really having association involvement. So I couldn't recommend it more to new practitioners.
Well, I have to say, you did have a great example down in Florida. One of the other CEs I did was with Teresa Toll.
Yes,
And, she's such an
yes, yes.
advocate down in Florida. And I've been, in my work with MPHA, I've gotten to work with some of the other pharmacy associations. And Florida is a great example of what state of pharmacy associations can do really well.
Mhm.
So I'm glad you got that experience and then came home to
Yes.
help us with, bring in the new generation, so to speak. Are you involved in any other pharmacy associations, either local or national?
Yeah, I think that association involvement can be varied. I'm actually involved with some associations outside of pharmacy as well. But really, I'm actually getting my feet more wet into ASCP or ASCAP, working with consultant
Mhm.
pharmacists and PQA, Pharmacy Quality Alliance, as well with the current role that I'm in. So I think you really should have maybe a variety of associations and different work that aligns with your goals and your mission as a pharmacist. So I strongly encourage it as you can with, the balancing act of what you're doing as a pharmacist.
Yeah, I always say you don't have to join them all like I seem to have done, but I'm kind of like a pharmacy association junkie, but you should at least choose something.
Mhm.
You can't, pharmacy can become very insular, if especially in certain practice settings, and especially now after COVID, where a lot of times we work virtually, that you can kind of get in your own little bubble and
Mhm.
you forget about the world around you, and our associations really keep us grounded to that. And like you said, very important about advocacy and expanding our scope of practice. Like, those things can't happen without our associations, and they need our support, quite honestly. I mean, memberships are down. So it really, if they don't have the resources, just like we're going to talk about in a little bit, if you don't have the resources, you have too much to do and not enough to do it with, it makes it very difficult. So we've developed a podcast that offers 30 minutes of ACPE accredited continuing education on preventing adverse drug events, which has become your niche. We'll discuss strategies on how to prevent medication errors and the concept of a culture of well-being. So before we talk about what listeners can expect from the actual program, can we talk a little bit about Clarent and your role there?
Yeah,
Um,
yeah, sure. So
just to
currently
get our listeners an idea of what it is and what companies like Clarent do.
Yeah, I think I'll focus specifically on the contract that I'm working on, which is a part of the Quality Improvement Organization with CMS. But Clarent as a company has a lot of different contracts from different states, federally, et cetera. But the contract that I'm specifically on works to really enhance quality for all Medicare beneficiaries. And two main areas with nursing homes, but the area that I tend to focus on is for community partnerships. And that really focuses on those high-risk medications through various transitions and community coalitions. But as far as the drugs specifically, it's the high risk. So looking at opioids, insulin, diabetes agents, anticoagulants, and also we're looking more now at antimicrobial stewardship and a more intense look into psychotropics as well, especially for our older adults.
Great. Well, you really are involved in an area of pharmacy practice I don't think most would, most people, let alone pharmacists, would even think of. But so before we talk a little bit about the CE we've developed, we do need to mention that the views, thoughts, and opinions expressed by Tosin in this podcast and the CE podcast are solely yours, right? And do not represent the views, policies, or positions of Clarent. Any content provided by the speaker is of their opinion and not intended to represent any group, organization, or company. So we got that out of the way. So let's dig deeper into the CE podcast, which our listeners can find on the ConveyMed app, and it's titled Preventing Adverse Drug Events Through a Culture of Well-Being. So no one wants to be the reason an adverse drug event occurs, especially when it results in patient harm. So we can never talk too much about how to prevent these situations. And I'm president and CEO of Pharmacists, Ethics, Education, and Resources, which we call PEERx. I continually emphasize that our primary responsibility is to our patient. We're that last line of defense. In a lot of cases, no matter what your practice setting, we're the ones ensuring the patient receive the correct medication and know how to take it and know when to take it. And, we're that last step. So without giving too much of the CE away, you bring up the phrase culture of well-being. And I have to be honest, when I got your title, I had to, do a little research, like, well, what do we really mean by that? So what is culture of well-being, and how does it relate to adverse drug events?
Yeah, I think the idea of prevention of adverse drug events, you think about medication safety and the larger umbrella of patient safety. And under patient safety, there's this thought of a just culture. You need to have a just culture in place in order for people to feel comfortable reporting different types of errors, having systems in place to improve those efforts as well and have those quality improvements. And I believe that there's a strong pillar for well-being in this just culture, which really defines a culture of well-being. If we want to focus on patient safety, we have to ensure that the mental and overall well-being of our healthcare professionals that work for our patients is well taken care of. And now more than ever, we have data that aligns and shows, well, when this well-being isn't being considered, patients are at harm. And that's something that I hope that the listeners will really begin to understand after this podcast.
It's kind of like when you take the flight and they teach you to, you put your mask on before you put it on someone else, because we can't be doing, there's another ethical principle, beneficence, doing the most good. We can't do the most good as pharmacists if we're not taking care of ourselves. So in a lot of cases, I'll say, self-care, it's not selfish, but it goes a little bit beyond self-care. It's almost like we're responsible to take care of ourselves so we can take care of others around us. And also that responsibility, especially in a role like what you have, or, me as a former retired pharmacy owner, that we make sure the environment that we are creating lends itself to that. So we do talk a little bit about that in the CEs. So I think we've given our listeners a good teaser about the continuing education podcast. And again, the title, Preventing Adverse Drug Events Through a Culture of Well-Being, is available on the ConveyMed app and the Pharmacy Podcast Network. Both organizations are big supporters of PEERx, and we appreciate everything they do for us. And this ACPE accredited 30-minute session is free, which is fabulous, and provides 0.5 CEUs. It's actually one of 4 of a series all on medication safety. And again, very fortunate that Waypoint RX really sees the value in supporting pharmacy ethics and my mission of what we're trying to do with PEERx. So we do appreciate their support of this series because it wouldn't have been possible without them. So you can download Convey Med for free from your preferred app store. The Pharmacy Podcast Network also has more information. And additionally, you can find a link to Tosin CE podcast on our website at PEERx.org. That's PEER, PEERx.org. 2 R's. It's the only way I could do it. So before we go, how can pharmacists learn more about health improvement organizations and how we can collaborate? Is there any resources out there that pharmacists can connect with?
Yeah, I would suggest there are quality improvement organizations throughout the nation and the various districts and territories. So I suggest that you kind of do a search for what's the quality improvement organization for the area that you currently practice in. And then, feel free to reach out to myself. I'm happy to connect you with any resources possible. And I definitely will be providing a lot of tangible resources related to well-being. And I'm happy to share those with anyone who's interested to really figure out what are the next steps.
Great. Well, I know you're on LinkedIn.
Yes.
And I'm very fortunate to know exactly who our health improvement organization is for the Maryland area. So, and you can always, our listeners can reach out to me. I can certainly connect you to Tosin. So thank you so much for your time today, Tosin. Again, Dr. Tosin David, a medication safety expert, frequent presenter at different associations, and her CE podcast, Preventing Adverse Drug Events Through a Culture of Wellbeing, available on the Convey Med app and the Pharmacy Podcast Network. For more information about our grant sponsor, Waypoint RX, and their solutions for independent pharmacy, go to waypointus.com, WAYPOINTUS.com. And for more information about PEERx, it's PEERx.org. Our medication safety continuing education podcasts are available on the Pharmacy Podcast Network and the Convey Med app. Got it all through that so that you know exactly where to go. So thank you for joining us today, everyone. Bye. Additional programming is available on the PEERx website, which is PEERx.org. Again, PEERx.org.